If you're searching for a way to head into 2012 with a new revived look, you've come to the right spot. Keeping all of us up to date with the latest in cosmetic surgery procedures is the goal of Dr. Jeffrey Raval. He offers products that have made cosmetic surgery a lot more affordable. Dr. Raval has a great technique to rejuvenate your skin. Today, he has great news about injectable fillers and the liquid facelift. Hi, nice to see you both.
Good morning.
Thanks for coming on. So let's talk about the greatest fear of cosmetic surgery. Is it the pain?
It's the pain. Well, I guess I wouldn't say it's one of the biggest fears, is that people are always asking me about, does this hurt? I mean, there are other things they're concerned about. It. What are some of the side effects? And one of them is lumpiness, which is we'll talk about how this one technique actually addresses both the concerns of pain as well as decreasing lumpiness whenever you get a facial filler. One of the things I want to talk about today was a lot of the facial fillers, like Restylane, recently got FDA approval to change their name to Restylane L. The L means that they add lidocaine into the filler itself. Lidocaine is like Novocaine when you go to the dentist. It's a numbing agent that results in less pain when you do the injection.
Okay, so you don't have to worry about it. It numbs it as it goes in.
It numbs it as it goes in.
Okay, very good. And you've actually done some modifications yourself to even make it better.
Correct. We found that if we even add a little bit more lidocaine with it, it controls the pain. And then we add a little something called epinephrine, which is adrenaline. Adrenaline or epinephrine causes the blood vessels to squeeze down, and it eventually leads to less bruising. By adding a little bit more volume, so we're adding a little bit more fluid into the filler, it also leads to a thinner injection, which leads to less lumpiness, which also addresses the other concern that people have, the lumpiness. So it's not that you're getting less filler. When I say thinner, it's not that you're getting less filler. You're getting the same amount of filler. We're just adding it we're just distributing it in a little bit of a thinner formulation. It's like saying you put a cup of or a teaspoon of salt in a cup of water or 2 cups of water. You're still getting the same amount of salt. It's just more dilute. Spreading
it out so there's no lumpiness that people are concerned about.
Yes.
I'm talking to Dr. Jeffrey Raval, 303-381-FACE. That's a really easy phone number to remember. And so you're going to demonstrate how you do fillers. And Doctor, where would fillers go? Around the mouth, around the eyes?
You know, this is really, so now that we're thinking about fillers, and we mentioned the liquid facelift earlier, we're really getting an appreciation that as we age, we lose volume. The whole face loses volume. So we're actually putting filler everywhere. We're actually putting filler not only in the cheek, the folds, the lips. We're putting it out what we call the submalar area. We're actually adding it to the temples. We're even actually putting it in the forehead now, which can, one, reduce the wrinkles, but it also can actually raise the brows a little bit. And so we're actually doing, again, a liquid facelift. We're actually lifting the face by adding volume. The analogy I like to use, it's not the best analogy, is that we all go from a grape to a raisin as we get older.
Yeah.
And by adding volume, it actually helps expand that and lead to a younger look.
Okay, so the filler you mentioned in the forehead to kind of get rid of wrinkles, raise the eyebrows.
Yes.
And I know Botox can do that.
Yep.
I don't know why I know that, but I do. Would you suggest filler or instead of Botox? So either or.
You know, some people do better with one or the other, or more commonly, we're seeing people do well with a little bit of both.
Okay, very good. Okay, so show us how this
works. All right, so here's the Restylane L, and this is what it comes in. And here's my modification. My modification is we add a little bit of lidocaine in there, additional lidocaine with the epinephrine. And I've already put that in this syringe. And so what we do is I connect these two. I mix the Restylane in with the lidocaine.
Okay.
And we literally put another syringe to mix it. And I literally just go back and forth and mix this up until I get a nice even distribution of the Restylane with the filler. By the way, I can do this with any filler, and we do this with any filler. So Juvederm, Radiesse fillers, we do mix it as well, and we do the same thing as we do with the Restylane.
Okay. And how long does the filler last once you put it in?
The filler lasts a long time, actually. It can last up to a year, year and a half. And you can have a nice correction for that long. Some people were noticing it last a lot longer. The duration, I'm going to actually stand up and start showing.
Oh, go for it, yeah.
So, and I'll just keep talking. but the duration actually is largely dependent on where you do the injection. The area that moves more, if there's an area of the face that moves more, it tends not to last as long, but it still lasts about a year. Here's another modification that we're doing with Lori. And what we did is we pre-treated her with a numbing cream, and it's not the typical numbing cream that you see in most doctors' offices. We actually had a pharmacy make this cream up for us. And it's a little bit stronger. It's a little bit more intense of a cream. Again, providing additional numbness for this area, more comfort. Go ahead and lean back just a little bit.
So you can find it only at your location?
Yes, where we have a pharmacist make it up specifically for us.
Does it tingle or hurt at all, Lori?
The numbing cream?
Oh, no.
Okay.
I didn't even know it was there unless I looked in the mirror.
So here's a newer area that we're starting to inject. And one of Lori's concerns was that her cheekbones were getting flatter as she gets older, which is something that happens to all of us. So we're actually going to do a cheekbone injection or a malar augmentation.
I got to see this. I'm going to get over closer if you don't mind.
I'm going to turn over this way. Again, this area tends to get flatter as we get older.
Okay.
So we're going to go ahead and just...
So you're filling out her cheekbones.
Yes. We're going to give her her cheekbones back, and a lot of people say, "Well, I don't want to look like I've had anything done."
No.
And my answer to that is, it's not that we're going to make you look plastic or anything. We're just trying to get you back to the way you looked when you were 20, or the bone structure that you had when you were 20.
Yeah.
So, and you know, for Lori, she's only 22, so it's really not much of a step for her.
Fabulous, darling, fabulous.
So, and then again, we would just go all around this area. I'll just stop for now.
Okay,
and
so
then
now
we would just go all along this area until we got the augmentation that we want.
Now that you have a little break there, did that hurt, or what does it feel like?
Just like a little pinch.
Really? Mm-hmm. Okay, and there may be a little bleeding.
A little bit of bleeding, yeah.
Do you have to worry about any kind of bruising?
You can get some bruising. It happens. It's a needle injection. The great thing about our office, since we have a laser clinic, is that we actually have lasers that can reduce bruising after you get it. So we offer that as a service as well.
Here are some before and afters that we're looking at.
Yes. Now, this is really kind of photos to show what we are capable of in our office. Not only filler, but laser peels and some Botox. This person had some laser peels as well as filler around her lips, cheeks, nasolabial folds, and then we did some Botox to her forehead and her frown area. And you can see just by in-office procedures the kind of dramatic change that you can achieve with cosmetic procedures these days.
What kind of special offer do you have going on right now?
So with these fillers, we're offering a deal, 15% off any filler for your first 3 syringes. And that's a value of up to almost $200.
And it lasts for a year and a half, possibly,
yes.
You said.
And possibly longer.
This is your new location, which, by the way, congratulations, you had a nice little open house where over 400 people showed up. And
yes.
That's because the rumor is out.
Yes.
Dr. Jeffrey Raval is a great doctor. It's where you go to, right?
Yep, it is.
All right, thank you very much. And thanks for coming on and letting him demonstrate that.
Oh, my pleasure. Yeah.